Now, I could go and tell you about other structures in the bacteria cell wall, but then I find that you should understand the cell walls. Like, this is the basic difference, right? Because, like, whenever you do a diagnosis of bacterial disease, whenever you study about any bacteria, the description of the bacteria will always contain this is a gram positive or gram negative bacteria. So you need to understand what do they actually mean. Okay. So I told you about the function of what? Peptidoglycan, that is the main structure of the cell wall. Teichoic acid helps to anchor it, right? Peptidoglycan is also present in gram negative. Now, there is something called a periplasmic space. Now, I'll tell you what's the function of periplasmic space. So, the function of periplasmic space is, it is actually involved in something called antibiotic resistance. Okay, can someone tell me what does antibiotic resistance mean? What do you mean by antibiotic resistance?
It prevents the bacteria from antibiotics that we.
Yeah, exactly, right? So whenever antibiotic resistance basically means you are giving the antibiotic, but the bacteria is not dying. It is resistant to this antibiotic, right? So how does there are multiple mechanisms by which a bacteria can be resistant to antibiotic, right? So this periplasmic space contains one of these things. This periplasmic space contains an enzyme. Okay, it contains an enzyme. Oh, I touched this. Okay, it contains an enzyme. Wait a second. Okay, so it contains a enzyme, and the name of this enzyme is, can anyone tell me? No, right? You have not studied it. Okay, fine. The name of this enzyme is called beta lactamase. What is it called?
Beta lactamase.
It's called a beta lactamase enzyme, right? So why is it called beta? Like all the names have it their own meaning. Okay, beta lactamase. So it, since it's called beta lactamase, it should destroy something called beta lactam, right? The enzyme that destroys beta lactam is known as beta lactamase. Okay, I'll tell you what is beta lactam. Okay, so when we're discussing about site of action of antibiotic on the cell wall, we know that penicillin destroys the cell wall of the bacteria, that, and then water comes in and the bacteria dies, right? If you look at the structure of the penicillin, there is a ring, right? In the penicillin, if you look at the chemical structure of penicillin, there is a ring. This ring is known as beta lactam ring. Okay, so the penicillin that destroys the cell wall of the bacteria, if the structure of penicillin contains something called a beta lactam ring. Okay, so the beta lactam ring is, the penicillin contains a beta lactam ring, right? So the some of the bacteria, such as gram negative bacteria, contain a periplasmic space, and the periplasmic space contains an enzyme called beta lactamase. Okay, and this beta lactamase enzyme, as you guessed it, destroys the beta lactam ring, which is present in antibiotics such as
Penicillin.
Okay, all of it makes sense now. Penicillin, right? So do you know the importance of antibiotic resistance? It's one of the most important things that are happening in medical science. Is one of the biggest problems in our world.
Doctor are prescribing the antibiotics, but that is not working in the patients.
Yeah, exactly, right? And then so many patients, like you prescribe so many antibiotics, but none of them are working. There have been cases like the patient has a bacterial infection, but the bacteria that is causing the infection is so resistant to antibiotics, all the antibiotics, that as a doctor you can't even treat the patient.
Yeah.
So some patients have even died because of some simple disease such as a throat infection that has spread and spread. It goes to the lungs, pneumonia. And if the throat infection is caused by a very resistant organism, such as there's a bacteria called MRSA. Okay. Now this is something else that I'm just telling you. There's a bacteria called MRSA. Okay.
Okay.
That is methicillin resistant Staphylococcus aureus. Okay, this is the name of a bacteria. So this MRSA bacteria is so resistant to all the bacteria antibiotics that if you get a MRSA infection, small infection, none of the antibiotics work. Right? I mean, but so many antibiotics don't work. So the importance is it can cause death of a person. So many patients have actually died because of resistant bacteria. Right? Another thing is, if this penicillin, right, it is a very common antibiotic, right, and it's very cheap as well, right? But if a bacteria is resistant to penicillin, then you have to go to another antibiotic, and this another antibiotic, for example, I don't know, gentamicin or something like that, that might not be as cheap as penicillin.
Yeah.
So the patient has to bear the cost of this antibiotic. So has antibiotic resistance increased the cost of the patient as well?
Yeah,
Yes.
cost
Right?
and like penicillin may have a lesser side effect, but
Yeah.
the one with higher side effect must be
Yeah,
used.
so you have to use even more and more dangerous, more and more stronger antibiotics, right? And sometimes the antibiotic doesn't work and the patient might die due to a simple infection as well, right? And then another thing that I want you guys to understand is there is some concept called hospital stay. Okay. Right, this is not in your topic, but I'm just saying these things. These are very important to understand. Okay, so number of days that a patient stays in a hospital, is it a good thing or a bad thing?
It is a bad thing.
Right, the longer the person stays in the hospital, it's very bad. Why is it bad?
Like cost will be obviously high, and
Yeah.
another is like another disease may infect the patient.
Yes,
The patient is himself immunologically
compromised,
less,
right?
yeah,
Yeah.
compromised, and another disease may attack.
Yes, and another thing that you felt like you forgot to mention is the number of days. For example, I am a rickshaw driver, okay, or
Yeah.
rickshaw puller, or a CNG driver, right, or a taxi driver. If I get sick for like 7 days, then who's going to earn for the whole family, right? So it causes a significant economic burden to the whole family, right? There is
Yeah.
loss of productivity as well. So in developed countries like in America and Europe, right? Like if you see in like in developing countries, we see like patients stay in hospital beds for a long period of time, 2 weeks, 3 weeks, right?
Yeah.
But in America and Europe, hospitals don't want patients to stay in their in hospital at all, because each day that the patient is in the hospital, the country is experiencing significant loss of economic growth,
Yeah.
right? So in those countries, they want to get rid of the patient. They want to send the patient home as quickly as possible,
Yeah.
right? Right, because they can go back to their home and resume their work, so the economy can grow.
Because there is another possibility, like if a patient is sitting there for like unusual days,
Yeah.
another patient is getting
Of
rid
course,
of the
another-
medical facilities.
Yes, exactly. Another thing is, if one is occupying the bed for 2 months, then another patient who might need the bed, he doesn't get the bed, right? So it's a really bad thing. So this antibiotic resistance is also related to this, because if a bacteria is not resistant, then you could just give penicillin and fix him and send him home in like 3 days, right? But if it's affected with a very resistant organism such as MRSA, then you have to try so many antibiotics, right? It will take long time to heal because the bacteria is very strong, right? So it also increases the number of days of hospital stay as well, right? So I just thought it was important for you guys to understand the actual importance of the thing that we are studying, right? So why is it so important? So now let's go back to microbiology, right? So what I'm saying is, gram-negative organisms have a periplasmic stage. In the periplasmic stage, there is a beta-lactamase enzyme, right? And then the beta-lactamase enzyme, and this beta-lactamase enzyme destroys beta-lactam ring, right? So for example, right? For example, there is this organism, okay? Right? For example, you had like a skin infection, pus, right? Normal skin infection, right? And then you gave penicillin to this organism, okay? If it was a gram-positive bacteria, right? And if the infection was caused in turn by a gram-negative bacteria, which one would the penicillin work? Will it work more on gram-positive or gram-negative bacteria?
It will work more on gram-positive bacteria.
It will work more. Could you say that closer to the mic? Yeah. Come on. It works more on
Gram-positive bacteria.
gram-positive bacteria. Why does it work more on gram-positive bacteria?
Because gram-negative bacteria have antibody resistant.
No, antibiotic
Antibiotic, yes, it is
resistant, right?
antibiotic
And why are
resistant
gram-negative
antibiotic
bacteria antibiotic resistant?
Because the
Yeah.
beta transminase enzymes is present.
Beta-lactamase enzyme.
enzyme is
Yeah.
present.
You're just hearing these words for the first time, so you can't
Yes.
remember, right? So if you give this penicillin, are you getting this? Penicillin, which contains a beta-lactam ring, to a gram-negative bacteria, what will happen? The penicillin will go to kill the bacteria, right? The penicillin will go to kill the bacteria, but the bacteria, or the cell wall of the bacteria, gram-negative bacteria, already contains the enzyme beta-lactamase, and this beta-lactamase will automatically destroy the penicillin even before it goes inside the bacteria. So will penicillin be able to kill this bacteria? Yes or no?
No.
No, right? So another concept that you guys learned is penicillin or any other antibiotic that contains the beta lactam ring is not useful at all in gram negative organisms, right? Does that make sense? But does penicillin work in gram positive organism?
Yes, it
Yes,
works.
right? Because why? Because it does not have beta lactamase
Lactaminase
enzyme, right? Why does it not have? Because it does not have the periplasmic space.
Yes.
So periplasmic space contains beta lactamase enzyme.
Lactaminase enzyme.
Now one more thing that I want you to understand is, right, so all gram negative organisms, can we say all gram negative organisms are resistant to penicillin?
No, I think might be no.
Why not? No. You have to explain. You can't just say anything, right? Why no? Do all gram negative organisms have this cell wall? Right? All
Yes,
of them have it.
all have this
Since
cell wall.
all of them have it, all of them also have the periplasmic space. So all of them also have beta lactamase. So the actual answer is yes.
Yes.
So all gram negative organisms are resistant to penicillin.
Penicillin.
Does that make sense?
Yes,
Okay.
it makes sense.
Right. So does that mean all gram positive organisms are sensitive to penicillin?
Maybe
Why? Because
they doesn't have very
plasmic space and they don't have beta lactamase enzyme, right? And that's good way of thinking, right? Logically. But that is no. Okay? Like not all, because your thinking is right? Like in ideal world, gram positive organisms should be sensitive to penicillin. Right? The reason is, first, as he said, they don't have the periplasmic space and they don't have the beta lactamase enzyme. Right? But another reason is, see, penicillin is working on which part of the bacteria? Is it the ribosome or the nucleus?
No, cell wall.
Cell wall, right? So which bacteria has thicker cell wall?
Gram positive bacteria have the thicker cell wall.
Cell wall, right? So penicillin gets more room to work in gram positive or gram negative bacteria
Gram positive.
because it has more cell wall, so it has more cell wall to destroy, right? So organisms with thick cell wall, since penicillin is working on the cell wall, so penicillin will get more surface to work on gram positive organisms. So, right, that's not as scientific, but that's how you remember, right? So penicillin works more on gram positive organisms because A, they don't have beta lactamase enzyme, and second, their cell walls are thicker. So more cell wall means the penicillin has more things to work on, as opposed to gram negative, which already have a thinner cell wall. So they don't have much to work on anyways, right? You can think of it like that, okay? But in an ideal world, as he said, all gram positive organisms should be sensitive to penicillin. But because of this antibiotic resistance, okay, you know what happens is, for example, see, this is your gram negative organism, and this is your gram positive organism, negative and positive. Now again, I'm saying the same thing again and again because it's so important to understand. Okay, so this is penicillin. Which one of these which one of these organisms is sensitive to penicillin?
Gram positive.
Say it loudly, come on.
Gram positive.
Gram positive, right? So gram positive is sensitive to penicillin, right? And this gram negative, does the penicillin work in gram negative?
No.
Right? So this should be happening in an ideal world, right? But you know what? Bacteria are very, very nasty, okay? They're very smart. What do they actually do is, inside the bacteria there is another structure. Like this is your nucleoid. As I told, nucleoid is basically free floating DNA. Because the bacteria is a prokaryotic, I mentioned before, right? Like before the video started, right? The prokaryotic, they don't have a nuclear membrane. So their new DNA is outside. So this also has DNA like this, right? But apart from this DNA, they also have a structure called plasmid. Alright, so if you look at plasmid is nothing but a circle of DNA. Okay, a DNA that is present in a circle. It's a circle of DNA, okay? So what do these things is, what is the importance of plasmid is that gram negative organisms, they have an enzyme called beta lactamase. Right? All the gram negative have beta lactamase enzyme. Beta lactamase enzyme. So this enzyme is a what? Is it a carbohydrate or a lipid? It's a protein. All enzymes are protein. So this beta lactamase is a protein. Okay. So how do protein come from? Protein, the recipe to make protein is present in the mRNA, which comes from DNA. And I'm telling you, this gram negative or bacteria, all gram negative bacteria have beta lactamase enzyme because it's present in the periplasmic space. So does this also mean that all gram negative bacteria have genes or genes in the DNA that is responsible for production of beta lactamase?
Yes, obviously.
Yes.
So they have genes, beta lactamase gene.
Okay.
Does that make sense?
Yeah.
So in order to make the beta lactamase that is present in the periplasmic state, they have to have genes to produce it, right?
Yeah.
Okay.
So some of these genes, beta lactamase genes, is present in this plasmid because this plasmid is also DNA.
Okay.
Right? The plasmid, so plasmid contains genes to produce beta lactamase, right? So this contains beta lactamase genes. And can someone? I forgot. Can someone tell me what is the function of beta lactamase?
Beta lactamase have to
Destroy the
This
beta lactam
ring.
ring of penicillin.
Yeah, so beta lactamase destroy it. It's in the name, right? It destroys the beta lactam ring of penicillin. And once the beta lactam ring of penicillin is destroyed, it does not work. The whole penicillin is
Yeah.
destroyed, right? So what happens is, so ideally, as you said, right? Penicillin should work in gram-positive organisms. They don't have beta lactamase because it's not present in their structures. But what happens is there's a process called conjugation. Okay, basically, there's something called a sex pili.
Yeah.
Okay, like when you we'll discuss sex pili in a second. The bacteria basically have this thread-like, finger-like thing. Okay, this is known as sex pili, right? So the sex pili of this gram-positive organism, bacteria, and the sex pili of the gram-negative bacteria, they combine together, join together, and they make a tunnel. Okay, so from this tunnel, a part of this plasmid contains what? Genes for the beta lactamase. Plasmid of gram-negative organism. Am I right?
Yes.
Right. So this plasmid makes a copy of itself. Right.
So copy itself.
And then this copy of this plasmid goes through this tunnel and goes into this gram-positive organism.
Gram-positive bacteria. Okay.
Now, has this gram-negative, dangerous, resistant gram-negative organism transferred its resistance by this plasmid to this gram-positive organism? Right?
Right.
So this plasmid, which contains the information for resistance, information for beta lactamase, is now present in this gram-positive organism.
also.
Now this plasmid gets integrated to the original plasmid of this organism,
Gram-positive.
and then now this will also produce, because now it has the information DNA to produce beta lactamase. Now this,
enzyme.
even though this is a gram-positive organism, it can produce now it starts producing beta
Lactamase enzyme.
lactamase enzyme. Now, right, this process is known as what?
Conjugation.
And what is happening? This one is resistance and this one was not resistant, right? This one was oh shit. Okay, this one was oh god. Okay, here. I'll change this side. Okay. So this one was resistant, but this one was not resistant, right? So this resistant, this one was not resistant, this one was resistant. So the resistant bacteria is transferring its resistance to a non-resistant bacteria. So can we say this is called transfer of antibiotic resistance?
Yeah.
So this process is called transfer of antibiotics. So one more thing that you learn: a resistant or bacteria can transfer its genes for antibiotic resistant to a non-resistant bacteria. It's like if you have a good friend and a bad friend, the bad friend makes the good friend into a bad person, right? Right? It's something like that, right? Good, right? So keeping all these things in mind, I came up with this whole Better Notes channel, YouTube channel. So apart from this YouTube channel which you are watching right now, I also have tuition. So I also give tuition. So if you're interested in tuitions, you can contact me. I also have a Telegram group where like almost 200 plus students from different medical colleges are already added in a couple of my Telegram groups where they can ask me questions, or you can ask questions. I will try to help you guys in this Telegram group, or your friends might even help you. So it's like we have Telegram groups to discuss questions and like things you're struggling with in general. So make sure you join the Telegram group. And I have notes as well. The notes that I personally use for my own exam preparations, which a lot of my juniors absolutely love. Okay, thankfully they like it, right? So if you want these notes, and apart from the notes, I also have clinical videos. This is upcoming, right? So hopefully I'm also planning with my friends to make some clinical videos within the hospital itself, so that you guys can have a little bit more help on the clinical side of things as well. So if you are interested in any of these, the tuitions, the notes, the Telegram groups, all of this, the link to all of it can be found in the comment section, right? So the first comment in the comment section, you can find the links to all of it. So make sure you check out the comment section.